The following is an exclusive presentation of Cablevision local programming. TV that's close to home.
Attention deficit hyperactivity disorder, or ADHD, can affect kids and adults and may be related to sleep. We'll tell you all about ADHD on this week's Health Talk. We're coming up next. Dr. Andrea Peterson. Today on Health Talk, we're going to discuss ADHD. Our first guest is Dr. Tait Michael. She's the chair of the Department of Psychiatry at Norwalk Hospital. Welcome.
Thank you. It's nice to be here.
Thanks so much for being on Health Talk. So, attention deficit disorder, attention deficit hyperactivity disorder, pretty commonly diagnosed. Maybe you can start our viewers off by just telling us a little bit about what are we talking about?
Okay, it is very common. It's diagnosed in 3 to 8% of children, and about 60% of those will go on to have it as adults. And basically it's defined as it's two different groups of symptoms. One is inattention, and the other is hyperactivity and impulsivity.
Maybe you can tell us a little bit more about what characterizes inattention.
So that's an important thing. Inattention, the things you might see would be a child who cannot pay attention even when they're directly spoken to. They lose things, they can't finish, they can't follow through. A lot of symptoms that the kid would be quiet and not underperforming in school.
How do doctors or therapists decide, though, when this is out of the realm of normal? Because all kids sometimes can't pay attention, I think.
Right. And that is an excellent question, because a lot of times these symptoms are actually very general. So if you look down the group of symptoms, you'll probably identify with quite a few of them. And actually, I screened my family members, and we all screened positive. So it's important to have, there are other diagnostic things that you have to have as well. And one of them is it has to be pervasive. So it has to be present in, if it's a child, both home and school. And
why is that so important?
Well, it could be just a dynamic issue at home. If a child is having trouble with a particular parent or some particular issue, then it might not be translated to school.
And tell us a little bit about the hyperactivity piece.
So the hyperactivity piece is really, that's what we think of when we think of ADHD. We think of the little boy who's bouncing off the walls, who simply can't sit still, who's running around the classroom, who can't play quietly. That's more of what we think of when we think of ADHD.
Now, I have 2 boys, and they're pretty active. Again, this is more than just the typical kids being active, right?
Absolutely. And so to make the diagnosis, there needs to be what they call a clinically significant functional impairment, meaning that the child isn't making the appropriate progress that you would expect for their age and their intellect.
So both from the inattention side and the hyperactivity side, it's also about how well the child is doing in their important realms of life. Is that right?
Absolutely. And we here in Fairfield County live in a very competitive area. So we're not talking about a kid who didn't get into an Ivy League or a kid who's having trouble with their honors classes. We're talking about a kid who's really not functioning at school and not making progress.
I think that's important because I think I think there was probably an era when ADD and ADHD were underdiagnosed, and some people worry that maybe it's being overdiagnosed and tend to minimize the symptoms, but we're really talking about kids who really are struggling.
That's an excellent question. I think the studies now are showing that it's actually both. It's overdiagnosed in some areas, and it's underdiagnosed in others, is what we're seeing now.
Tell us a little bit maybe about in adults. What does this look like in adults?
So in adults, it looks a little bit different. You don't see quite as much of the hyperactivity, but you'll see distractibility. You'll see adults who can't keep a job. They may get a lot of traffic tickets. They have difficulty with relationships. So it doesn't look exactly like kids, and it might be hard to diagnose it in adults because it's a little less obvious.
Is this something that can develop in adulthood, or is it usually somebody who's had it their whole lives and now it comes to light in adulthood?
Actually, no, and that's an important criterion, is that it's a childhood onset disorder. So if someone doesn't have it, usually by the age of 7, then it's not present. It's something else. And it can, in adults, look like something else. There are diagnoses that look very much like ADHD.
So there may be adults who weren't diagnosed as children, but as a psychiatrist, if you're talking to somebody, getting their history, you can get a sense that this probably was present all along. Is that right?
Exactly. You can get school reports, you can talk to their parents, you can get some idea of whether it was present. There's also a genetic component, so sometimes adults are coming in saying, my child was just diagnosed with ADHD and I'm wondering if I have it.
Oh, that's very interesting. Tell us a little bit about what you see in terms of, are there formal testing, or kind of how do you go about really thinking about whether somebody has ADHD?
Well, it does take time to look at it. So you have the symptom clusters, and then you have the other important factors, childhood, pervasiveness, and a functional impairment. And then you look at it over time, and you also get collateral history, maybe from teachers or from parents or from family members, that sort of thing.
That can be really important in this disorder.
Absolutely.
Right? Is this something it sounds like it's not then something you can make a diagnosis kind of right on the spot often?
No, I don't think so. It's usually a little bit more complicated than that, and it takes some time to make the diagnosis. Because the treatment is an investment, and so you want to be sure of the diagnosis.
How do kids especially come to attention for this diagnosis? Is it often parents or teachers or a combination?
It's a combination. It's very commonly teachers and pediatricians. So the teacher will report to the parent, and they'll go to the pediatrician, and the pediatricians see an awful lot of ADHD.
And so then is the general workup initiated in the pediatrics office? And
I think very commonly. I think it's later on that they actually get to the child psychiatrist.
Maybe you can tell us a little bit about treatment.
Sure. I think of treatment really as at least two-pronged approach, if not more. So medications are part of it, but by no means the whole thing. There are other really important aspects of the treatment.
That's so important, I think, in most illnesses, but in most psychiatric problems, isn't it?
Absolutely. There are a range of medications that are very effective, but there are other treatments as well. And if I think of both children and adults, there are a lot of education and skills training things that are very important, like really organizing yourself, using a calendar, making sure that you use it every day, just working hard on being organized.
So there are some practical things that people can learn as well.
Absolutely. Yeah.
Can you tell us a little bit about medications?
Sure. There are a group of medications that actually the stimulant medications, which are amphetamine derivatives, and they've been around for quite some time. They were first used in the 30s, and they are the most effective usually.
It's so counterintuitive for many people, right? That you have somebody who maybe already isn't paying attention or maybe hyperactive, and you then give them a stimulant and they may get better.
It is counterintuitive. But it's very interesting because that actually tells you that you've made the right diagnosis. If you treat a child with stimulants and they get better, and it is quite an amazing transformation that they'll be calm and able to concentrate, able to finish their work. If you don't get that, you're either on the wrong track diagnostically or the wrong medication.
That's very important. Are there some newer medications as well?
There are always some new amphetamine derivatives coming out. Some of the longer acting ones, there are patches that last longer. The first ones to come out were very short acting, so it was difficult for kids who might have to take another medication at school. Now there are some longer acting ones. There are some ones that aren't amphetamine related either, that are FDA approved and effective as well.
Now kids, though, who really do have ADHD and are benefiting from these medications, how long do they tend to need to be on them? It's a series of years.
It tends to be a series of years. If you think about 60% of children will go on to have it as adults, 40% won't. So 40% will either be able to manage their symptoms or will end up not needing the medication later on in life. One of the things I've noticed after doing this for almost 20 years now is that the patients and families who are most successful are the ones who kind of incorporate all of the techniques, the education, maintaining responsibility for a kid's actions, your actions as an adult. These are the people who are most successful.
When should patients and families seek out a psychiatrist? Should all kids with ADHD be seen by a child psychiatrist?
I think that there are pediatricians who are very familiar with the disorder and comfortable treating it, and others who are not. It really depends on the access. I know that in a lot of parts of the country, it's very hard to get in touch with a child psychiatrist. We have them in this area, but that's not the typical.
We're very fortunate in that way.
Yeah.
And sometimes it's like other disorders that primary care providers may be very comfortable dealing with many patients with the disorder, but if it gets more severe or more complicated, referral to a specialist might be indicated.
That's often the way it happens.
Tell us a little bit more about some of the practical or the other side of the non-medical side of treatment.
The non-medical side. There's a therapy called cognitive behavioral therapy, which is an excellent form of therapy and works very well. And if you think about a lot of these kids, if they're not successful as youngsters, they end up having self-esteem issues. Cognitive behavioral therapy as an adult is a way of restructuring your thoughts so that you can think about how you're going to be successful, and you can be more positive, and you can be more confident about what you're doing.
When somebody has not had the diagnosis made and then presents to you, say, as an adult, how successful is treatment at that point?
It's fairly successful. I would say 2/3 of the adults do well on medications, on the first medication that you might try, or the stimulant class. But that leaves 1/3 where that didn't work so well. So it really is the combination of strategies for helping. And there are ways, and as I said before, there are things that can look like ADHD in adults: depression, anxiety, substance use problems, bipolar disorder can look very similar.
So it's important not to jump to the diagnosis, but for it to be made really thoughtfully and carefully.
Absolutely.
We have just about 30 seconds left. Do you have last thoughts for our viewers about ADHD in kids or adults?
I would say one thing I would add is that our society these days tends to have a little less tolerance for the behavior that they used to. So I think there is a danger of overdiagnosing these kids. And the other thing is that children will grow out of it. Someone who's 4 years old may not look at all the same when they're 6.
So that's very important.
So it's important not to overdiagnose.
Thank you so much for all that really useful information.
Thank you.
Thank you. When we come back, we'll talk more about ADHD, especially in children. We'll be back after a short break. Stay tuned.